I hope now both the types of logic are cleared and we have a thorough knowledge about both the inductive and deductive logic. In homeopathy, basically, we are using both. We are using both inductive as well as deductive logic in our practice, but we should understand that inductive logic has a special or more role in homeopathy. Fine. So homeopathy was founded and constructed on the principle of scientific or inductive logic. So for homeopathy, as a method is drawn logically according to the strict rules of inductive generalization from data which have been derived from direct observation to pure experimentation. So the birth of homeopathy can be presented as the best example for inductive logic. Now we'll understand and explain all these four steps. There are four steps which includes in the inductive logic and they are directly related to homeopathy. Okay. So what are these four steps? First one is exact observation. Second one is the correct interpretation. Third one is rational explanation. And the fourth one is the scientific construction. Now we'll deal with the each one. So the first one being exact observation. We all know that Hahnemann was a keen observer, right? He just read while translating the book by Dr. Cullen in Treatise on Materia Medica. It was written in some small footnote in the book that cinchona bark cures malaria, right? Everyone know this because of its bitterness. Though his work was to translate the book only, but the curious mind of Hahnemann wanted to investigate the truth. So he experimented. He took the cinchona bark and he experimented, observed everything. Only because of his intelligent observation, this leads to the birth of homeopathy, right? So exact observation is very much important because until and unless you won't observe, you won't, like you just don't have to see, you have to perceive what is behind it, right? So a very keen observation is required to practice homeopathy. Fine. So first point in inductive logic is exact observation. There must be very keen and exact observation of the patient, of the surrounding, and each and everything around. Now the second one being correct interpretation. Now he observed, right? Whatever he observed during that translation. Now Hahnemann experienced the effect of the cinchona bark on his own body. He was convinced that the cinchona bark has the capacity to produce malaria-like symptoms. But he wanted to confirm that. So he take his experience and as a particular premise he wanted to verify on the other fellows. So he expected and all of them whomever he experimented with were attacked by malaria-like symptoms. Considering each person's experience as a particular premise. Here, understand this that the experience of each person is considered as a particular premise because it is factual, right? It is based on experience. So that was considered as a particular premise. Hahnemann came to the general conclusion. General inference was derived that cinchona bark cures malaria because it has the capacity to produce malaria-like symptoms in healthy human beings and not because of its bitterness. It's not because of its bitterness that it's producing. This is what correct interpretation means. Okay. It was interpreted before it was written that because of its bitterness it's producing or curing malaria, right? But he observed that it's not because of its bitterness, but it is because it is producing malaria in a healthy human being. So correct interpretation is very much required. Now the third one is rational explanation. Without making any, haste, without hurrying anything, Hahnemann went through the medical literature and there he found the law of similia. We all know what is law of similia, right? So he came to know that his predecessor ancestors like Hippocrates, Paracelsus and many more used the law of similia, but they used it occasionally. They were not following it. So he wanted to apply this same law on other medical substances, right? All other medicinal substances, he wanted to apply that whether law of similar works or not. This is rational explanation. Okay, you need to explain what is rational explanation. Basically, it is something which is applicable to everyone, which is applying to everyone without any exceptions, without any, like problem, and it is uniform. So he proved various drugs on himself and other fellow healthy human beings and found his experiment showing universal results. So that is what is rational explanation. So here he considered each medicinal substance as a particular premise. Again, inductive logic. See, here also he is considering each and every medicinal substance as a particular premise and then constructed a generalized conclusion. Again, particular to general. In inductive logic, what we are doing? We are going from particular premise to a general conclusion. So he took particular premise as each medicinal substance and come to a general conclusion that drugs cure diseases because of their capacity to produce the same disease in a healthy human beings. He said that drugs are able to cure a disease only because they are able to produce the same disease or the similar disease like symptoms in the healthy human beings. So this is how he gave the rational explanation about the universal fact about the drugs and the medicinal substance. And according to inductive logic, basically he took each and every medicinal substance as a particular premise and then come to a general conclusion, and this is how inductive logic is used. Okay, I hope this much is clear. Moving on to the last one, that is scientific construction. So as we are talking about Hahnemann, homeopathy, right? So based on his explanation, based on his observation, interpretation, you can see there is one flow, right? First he observed, then he interpreted, and then he explained. And on each level he is using some inductive logic. He is taking some particular premise and then coming to a general conclusion. Moreover, it is a universal conclusion. So we should understand that also. So fourth one is scientific construction. Now we have given the explanation. Now based on his experiment and research of literature, Hahnemann could confidently state that medicines cure disease because they can produce similar disease in healthy individual. But this is not what he said, like bluntly or something. After 6 years of experiments, in the year of 1796 came out with his first essay on homeopathy. Okay, even after having so much of explanation, so much of experience and everything, he experimented and waited for around 6 years. Then he came out with an essay on homeopathy, and it was for the very first time in an year 1796. And the name said that an essay on a new principle for ascertaining the curative power of drugs. Okay, as we all know that he was an allopath, right? Before leaving that job thing and taking that translation work. So if we consider the experiments of Hahnemann on different individual as a particular premise, again inductive logic. If we consider the experiment of Hahnemann on each and every different person as a particular premise, and the construction of law which he did on the basis of the experiment, which law I am talking about? I am talking about the law similia similibus curanter. So basically that is the conclusion, right? That is the general conclusion. So here, according to inductive logic, what he did, he took the premises, particular premises of experiences of each and every individual and draw a conclusion which is a general conclusion, again particular to general, inductive logic. He got similia similibus curanter. We can clearly state now that homeopathy is based on inductive method of logic. I hope this much is clear. So here the first one is characteristic symptom. So what is characteristic symptom? What is characteristic in general? Characteristic is something which is particular, which is confined to that person, to that thing only, right? It is characteristic. So in homeopathy we have a lot of remedies, okay, lot of patients come, and we know that here certain things are very much confined to that particular person, which is applicable in that particular remedy only. So we tell that this is characteristic of this patient, this is characteristic of this remedy, likewise, okay. So what characteristic symptoms means? They are the general symptoms or generalization which we have done by deductive logic from particular symptoms, okay. So basically we mean that what different things have in common. Like for example, we have one remedy known as pulsatilla, okay. So what happened in pulsatilla? The symptoms, particular symptoms which are there, they'll aggravate in warm room and they will ameliorate in open air. I hope you understand what is aggravation and amelioration, okay. So basically all the symptoms they aggravate in the warm room and ameliorate in open air. So this aggravation in warm room is what basically it is characteristic, okay. It is in general of pulsatilla that whatever patient will come which will require pulsatilla remedy will have aggravation in warm room. So if I am there and I have aggravation in warm room, then we can think of giving the remedy based on this characteristic symptom, okay. So I hope this is clear what is characteristic symptom. So characteristic symptom is something which is very much common in that remedy, in that person, in that particular thing. So characteristic symptoms are the general or common symptom which are particular to that particular thing or person or patient, okay. Now the second one is pathological unity of symptom. We all know what is pathology, right? Changes or diseases that happen in the body. And symptoms are nothing but the manifestation of those diseases. Those diseases tells us that they are present in the form of symptoms, okay. So disease is known by its symptoms. It is nothing but the pathological or changes in the body, organs, tissue, vessels, or anything like pathology. So logically, disease is nothing but the pathological unity of symptoms. So basically, physician is collecting each single pathological symptom which is present in patient, and with the help of inductive method, basically where what we are doing, we are taking some symptoms which are particular, then we are deriving a conclusion. So by inductive logic or inductive method, हम लोग what we are doing, we are logically combining, okay, and giving it a general conclusion, and that heading we are calling as diagnosis of the disease, okay. So instead, if we consider each single symptom separately, okay, if I'm taking each and every symptom separately and we are not confining it, we are not making a unity out of it, a true picture of that particular thing, we'll never find a disease, we'll never able to diagnose what exactly is there, and nor will be able to give a homeopathy remedy, obviously. So let's take an example for this. If a patient came with the complaint of cough, chest pain, evening rise of temperature and weight loss, by considering only one symptom like cough, or by considering only one symptom like chest pain, we cannot diagnose what happened or what the condition is, because many diseases will have cough, many diseases will have chest pain. But if we consider the above symptom as a collective whole, collective picture, a person having cough, chest pain, evening rise of temperature and weight loss, then we'll come to a conclusion and we'll be able to diagnose that this condition is tuberculosis, okay. But if individual symptoms are taken, then we won't be able to appreciate what exactly is. So basically what we are doing, all the pathological changes, what are pathological changes? They are nothing but the symptoms, okay. So all the symptoms like chest pain, cough, or temperature rise, so all these pathological symptoms will be taken together, we'll have to unite them, make a unity of it, and then we'll be able to diagnose what exactly the condition is. The second example is, based on one single symptom we cannot select a suitable homeopathic remedy, right? to a patient, because the drug picture in homeopathic Metria Medica, we'll understand this later, that whatever patient tells about the disease, we have to take the whole, every symptom. We'll have to make a picture out of that patient, that yeah, from head to toe, from all the symptoms, this is what he's suffering. And that drug picture, then we have to similarize with the Metria Medica, which is already proven picture, right? So if we'll take only one pathological symptom, we won't be able to match it with Okay, so here it is very much important to make a unity of all the pathological symptoms and then go for it. Once the patient narrates all his symptoms, they have to be logically combined into a whole, to which we have to select a remedy. So in this manner, I hope you understand that by our observation and collection of facts, we can construct an individual character. Okay, so here this also is based on inductive logic, because here we are taking the particular premises which are logical, and then we are coming to a general conclusion. Fine. So the third one is totality of symptoms now. We all know that in our case taking, what we are doing, we basically take all the common symptoms, we also gather the uncommon symptoms, the peculiar symptoms which we say, we have certain characteristic symptoms, we have some pathological symptoms. So what is totality of symptoms basically? Totality of symptoms in general means sum up of all the symptoms, right? But it is not just numerical sum up, right? Here we have to understand and interpret also, like what is important. We should categorize which symptom is uncommon, which system and which symptom is common, right? All these have to be synchronized, and here a lot of logic is required. I hope you understand that this process needs a very much logical reasoning of isolating the diagnostically important common symptoms and interpreting what is characteristic symptom in the patient, so that a whole of a picture of a patient can develop. We can get a individual picture, a unique picture of a particular patient, and this will help us to select a or prescribe a remedy. So the totality of symptoms for a homeopath is not just numerical totality, but the totality is the collection of individual symptoms which are particular to that particular patient, and then they are logically related to each other and helps to maintain as an individuality of the patient. So a homeopath employs a logic in isolating the totality and later prescribing a remedy based on that totality. Okay, I hope you are getting it. Now the fourth point is individualization. Again, we all know that we believe that every individual is different, every person is unique, so every patient is different, right? We can't prescribe or we can't give medicine similar or same to every person. We are not doing like this, that if a person is coming up with some complaint like chest pain, so we'll give the same medicine for every person coming with chest pain, right? Here what we are doing, we have to take the whole case, we have to ask for each and every question, each and every symptom of the patient, we have to derive a totality of symptoms, and that totality is helping us to make the individualizing the patient. So basically the examination of the patient is very much required in individualizing. Of course, if you want to individualize, if you want to separate or differentiate a person, so certain things you have to do, and the first thing is examination of the patient. It is done by giving less importance to the common symptoms. There we won't give much importance to common symptoms. We'll go for a particular symptoms and make it complete. Okay, and what is complete symptom? Any symptom is said to be complete if it is having LSM. LSM, what is LSM? Location, sensation, modalities. If there is one symptom, then you should get these three subheadings of it. Okay, if you are having any pain, where it is, location of that pain, sensation of that pain, how is that pain, and modalities of that pain. Modalities means when this pain is aggravating, when this pain is intensifying, and when this pain is ameliorating or getting better. So there should be complete symptom, and we should go more on the particular symptom rather than on the common symptoms. This is the first step. The second step is the study of the case. If you want to individualize the case, you have to study the case. Comparing the patient case with the drug picture given in the Materia Medica is important. Okay. So this all comes under individualization. Here you have to study the case, compare the patient case with the drug picture of Materia Medica. Now the third step is the finding the one. What is the one? The one is the similar most drug, which can be selected with the help of repertory, but here you have to get the one drug, and the one drug is basically given on the basis of individualization. When you have examined the case, taken the case and studied the case, matched the case with the Materia Medica drug picture, then. So in every moment of the above mentioned step, you have to beautifully apply logic. In this field comes only by practice and with the help of individual interest. So you have to apply logic to individualize the patient by taking the totality and everything. Now the fifth one is art of generalization. A homeopath deducts the general symptoms from the data collected from the patient. Of course, now you have taken the case, okay. You have lot of symptoms. So of course you can generalize them, no? Like this, if a person is having cold and the cold is aggravated by drinking cold water, there is running nose, there is heaviness in the head, all this is general, right? If any patient of cold is there, majority of patient will be having these complaints, right? So this is the generalization. So you, out of the data collected of the patient while taking the case, a homeopath should know how to deduct the general symptoms. Here he must be able to pass a logical judgment on the value of symptoms. You should be logical that how this statement is, how this symptom is general, how this symptom is not general, it is peculiar or characteristic to the patient. Like fever. I'll take one example of fever. If in fever, usually you will feel thirsty, right? You'll have an urge of drinking more water, but instead you are becoming thirstless. So this is not general symptom, no. If a patient comes that I am having fever, I am having a high rise of temperature, and during that time I am thirsty also, I drink a lot of water after every 15 or half an hour, I want to drink water, that is general. But if a person is saying that I am having a fever and I don't want to drink water, I have for 2 even hours, 3 hours passes by and I don't feel like drinking water, then that is peculiar. Okay, I hope you understand what is generalization. So you should know the art of generalizing, because our prescription needs more of this logic of correct interpretation of the symptoms. Now the sixth one is generalizing the mental state of patient. This is most difficult task, right? Because here you have to generalize the mental state, you have to understand the thinking, the interpret the patient by everything as a whole, how he walks, how he talks, everything you should understand in this case. So this demands the exercise of the highest intellectual power of you. You have to be very much intellect while doing this. In most difficult cases of nervous or mental diseases, the physician must be trained psychologist or a logician. Okay, if there is some nervous disease or mental disorder is there, mental disease is very high, hyperactivity is there, during that time a psychologist or a logician is very much necessary. So now the last one is law of causation. So in law of causation, basically science believes that every effect has a cause. Okay, so nothing is happening without a cause. If even a tree or a like leaf is falling from a tree, there must be some cause behind it. Every disease has a causative factor, but the problem rests in identifying that cause which is creating a disease. Fine. Like in homeopathy, we know that we have certain exciting cause, we have some fundamental causes which produce disease. Based on those causes only, we have acute disease or chronic disease. We also have certain miasms. Fine. So, what is basically exciting cause? It is the one which produces acute disease firstly. For example, if someone is going out and they just drench in the rain, later got fever, got sick. So this is something called exciting cause. The rain was the exciting cause for that fever. Similarly, if we talk about fundamental cause, it is more of a prolonged or chronic thing. It causes chronic diseases. For example, if a person is coming with a chronic cough, sputum is there, chronic cough is there, and on investigation you will find out that a person is a chronic smoker, or not even chronic, a person is a smoker, he's having a habit of smoking. Then of course that is a fundamental cause, that is smoking. If you want to remove that cause, be it exciting cause or a fundamental cause, a person won't be relief. So, in science, we know that everything that is happening is because of some cause. So, every disease has a cause, but we have to identify. So, in identifying the exact basic cause of disease, we need a logical analysis. Our aim is to remove the remote causes of the disease and not just the proximate cause like bacteria or other microorganism, because even if you remove those symptoms or remove the superficial layer of that thing, it won't be cured completely. So now more or less in homeopathy we are using inductive logic, and it is more of evolutionary. As you know, we can identify new and new things, we can derive to new universal conclusion. So logic has to be applied by the homeopathic physician at each and every step of his practice. Successful prescriptions made by the homeopaths in the past are derived from their logical interpretation of the patient and suffering. You'll understand this basically, that many times it happens that you derive something and say that this is out of the experience, right? You get it because you have seen a lot of cases, so you know that this will happen. So more or less you need to apply the logic behind it if you want to have a good practice in homeopathy, if you want to be a successful homeopathic practitioner. So logical interpretation of the cause of disease in the light of analysis is very much required. Merely just matching or comparing the totality with the drug picture without any logic is not at all useful. So it is very much important to have a logical interpretation of the patient and his suffering. So I hope that this is for today. The topic is over, logic, and you all understand. Let me know in the comments if you like it, if you have any problem or anything, any suggestion. And I hope everyone just learned, got a thorough knowledge about this topic. So thank you everyone. See you later.